is it that physicians can do that AI can't potentially do in the future? What is it that's stopping AI from being able to do a lot of the tasks that we do when it comes to diagnostics? I believe you can already look for certain apps. They're able to help diagnose you or look at different health conditions just based off of information you feed it or off of maybe a scan or something like that. So, I mean, AI is already kind of going to that point. What's stopping it from being at the level of really just taking away physicians' jobs? One of the things that came up in the conversation I was able to be part of was maybe certain more procedural specialties not being affected as much, and specialties where maybe there's a lot more reading involved, or it's not as much things that are more dependent on human judgment that's involved. I mean, those jobs could potentially really be at risk. And another factor to consider as well is, for instance, one of the major themes that's come up in this podcast has had to do with health disparities, and how, even just for example, with one of the major themes of this podcast, the fact that even Black males such as myself only make up less than 3% of all physicians in the healthcare field, or the fact that, as we talked about in a pretty recent episode, the potential physician shortages that are going on, and how we could be looking at huge shortages, not just in physicians altogether, but especially primary care. If we just take a look at one of the articles that was brought up in a previous podcast, the AMC put out a statistic stating that the U.S. is expected to face a shortage of physicians ranging from about 21,400 to 55,200 just by 2033, which is really not that far away. So when we consider the disparities and some of the issues and shortages that are already here when it comes to physicians, could AI, by potentially taking away jobs, make that situation even worse? And so that's definitely an issue to consider. Now, one of the major points that really came out of the conversation I was able to have, and one of the things that I would definitely present on this podcast, is I would just say, ultimately, what we really have to think about is not just what's the major problem going on in front of us, but also, ultimately, how do we deal with it? What's the response? And so ultimately, the conclusion that I've really been able to come out of this with is, okay, it really comes down to using AI to our advantage. Because sure, we could think about, okay, AI might be able to take away jobs and maybe be able to stop physicians from doing this and that. But okay, how could AI maybe actually make our jobs better? Because there are a lot of aspects of the healthcare field and of just practicing as a physician and a medicine that may be a little bit more difficult for people to maybe do. I don't know if maybe that's charting or just different aspects of the job that AI could actually help improve and make better. So one of the immediate conclusions that I kind of came to was, hey, I think AI actually might be able to improve certain things. When we think about the primary care physician shortage, maybe this is actually something that could really help. One of the things I remember I brought up in a previous podcast episode when it came to shortages and all these things was that one of the things that could help is more like telehealth. And so one thing I figured is AI could definitely play into helping improve that, whether that's just making the process quicker, more efficient. And for that, I went again to a specific article that I found written by Jock Putney, titled "How Artificial Intelligence Can Help Primary Care Doctors and Their Patients." So just looking at some of the major points that was brought up in this article, one quote that was brought up that I thought was very interesting was that AI can unlock a physician's ability to understand a patient's needs beyond their 15-minute office visit by helping that physician make sense of longitudinal data from multiple sources, such as wearables, at-home biometric technology, and Internet of Things devices. So one thing that this article is mentioning is how tying technology into this could really just make the patient's job better. A lot of physicians are really only able to see their patients for about like 15 minutes tops. And if you're able to also integrate technology and being able to monitor patients' health and things like that, if anything, that could really help contribute to better patient outcomes. And one thing I would definitely say that I really think is a huge major factor is ultimately the human aspect of healthcare. Healthcare is not just dealing with a set of numbers or dealing with certain pathologies and trying to fix this issue and that issue, but it's also caring for patients as people. It's caring for people. It's taking care of others. It's helping each other. And so I think a major aspect of this that maybe isn't getting brought up enough is that it's not just about fixing an issue, but there's a human connection that's there between a physician and patient. There's a human connection and a type of empathy that can only really come from people and not necessarily machines and robots and computers. And so one of the other conclusions I come out of this with is, hey, there's a place for physicians just as people who are able to stand and help people. And again, that really just ties back to the type of physician I'm trying to be. I could see myself really trying to use AI to make my job more efficient and better and able to help my patients more. But ultimately, it's still me that's trying to help another person get better. And so AI is not necessarily just going to take that away completely. So I think that's another aspect that as much as people can maybe adjust to computers and using AI and all these different things as part of their care, at the end of the day, they can never replace that human connection. They can never really get rid of that human aspect of healthcare.